I want to give you food for thought on things that may be behind this current healthcare crisis. What are those hidden factors? And I hope this video will become worthy of sharing with others. So the H in HIDN stands for hormonal balance, and taking one factor in there, blood sugar control. We know that people with diabetes have what's called in the medical model a comorbidity, meaning they're more likely to have trouble with the virus because they have diabetes. So I hope someone at some point looks back at all the records and sees what is the hemoglobin A1C. That's the long-term marker for glucose control. What is the hemoglobin A1C for people that got in trouble with the virus versus people that had very little problem with the virus? Then the I is for immune strength. What is the vitamin D levels of people that had little trouble with the virus and people that had major trouble with the virus? What is their serum vitamin A levels? What is their serum zinc levels for the people that got in trouble with the virus? Because those vitamins have a big factor in our immune system. Even ionizable calcium affects how well our white blood cells can respond to infection. So look at those immune strength factors, detoxification pathways. Who has a fatty liver in these people that get in trouble with the virus? In the medical model, the research will use the term biotransformation. That's your big word today. But who has problems with their liver that got in trouble with their virus versus people that didn't? Who has lymphatic congestion? That's a little harder to measure lab-wise, but something to think about. And then neurological. Who has been in fight or flight? We measure that in our office with heart rate variability. We can see who has too much fight or flight, or called sympathetic dominance, that their immune system, their neurological system, which translates to their immune system, is going to have very little reserve capacity. There's tons of studies on heart rate variability with all kinds of health issues, and those with poor heart rate variability have worse survivability with many health conditions than those who have better heart rate variability. Also, the brain. We use a technique that releases trauma from the brain, and I'll give you a quick example and then we'll end this video. We have a patient who had years of sexual trauma as a teenager, and that is documented in the literature to cause disturbances in the immune system. Before seeing us, she had 25 years consecutively of a low white blood cell count. When we used our technique to release trauma from the brain, over a 6-week period, new labs were run, and for the first time in 25 years, her white blood cell count was in the normal range. That's the connection between the neurological system and the immune system. They work both together, hand in hand, to respond to any stress in our environment. And a virus is a stress in our environment, as many other stresses are as well. So this is food for thought on the hidden factors behind our 2020 healthcare crisis. So if you're looking for someone when the crisis gets over to help find the hidden factors in your health and work through this, that would be Winter's Wellness Chiropractic Redefined. I own the trademark on this communication model, so I'm the only one in the country that can communicate with you like this. And be sure and give our office a call and look us up on winterswellness.com. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined.